Hello and welcome to your virtual training session for today. My name is Christina Maddox, and today we're going to talk through the emergency number options that you have available to you in this country. There are a number of different ways to get help, and the most important number that I'm sure you all know is the 112. I teach my children 1 plus 1 equals 2, so therefore this number can be remembered very easily. However, you'd be surprised how many people in case of emergency do not remember these 3 digits, and for this purpose the emergency services have derived an app that is called Nora. The Nora app is for people who are not able to speak the German language, who have hearing impairment, speech impairment, people who have possibly got a choking situation, they can't articulate themselves, an allergic reaction where everything is swollen, where they can't articulate themselves. On the app you can determine the language that the app speaks to you. You can also determine whether you're calling for yourself, calling for someone else, do you need medical assistance, fire brigade, or the police. So it's just a number of drop-down menus where you can call for help, as well as give a more detailed description of the incident by selecting from those buttons on the app. The app will then transfer your GPS data to the emergency services so that you can be easily found. The same thing, should the app be unavailable, which sometimes happens, the SOS function on your telephone. So this is my favorite teaching moment or learning moment. Takeaway from this session is if you try and turn your mobile off, then you will be able to call for help by just either swiping SOS or pressing the emergency button on your telephone, which will then transfer your GPS data to your emergency services near you. Here you can also put some data, some health data in your telephone regarding some allergies that you might have, or some medication that you take on a regular basis. Are you chronically ill? Are you an organ donor? How tall are you? How heavy are you? What is your primary language? Who are your emergency contacts? So I work in the emergency services on and off myself. I can only urge you to equip your phone with your health data, so that when you are unconscious on the street or somewhere in a desperate situation, we can access that data outside of the locked screen on your telephone and can treat you accordingly and fulfill the patient's wishes. So there is also sometimes I get customers tell me that they only remember 911 in case of emergency, the US number, or 999, the number for the UK and some of the Commonwealth countries. So you can rest assured that these 2 numbers are also transferred to the 112 in case of emergency. So if you only remember your home number, that's okay. It's transferred, and vice versa also. So if you're in the States and you only remember 112, it is transferred to the right service. The 112 is EU-wide, so that if you are traveling anywhere within the European Union, it's the same emergency number. Now, we also have another number for non-medical emergencies, and that is the 1 minus 1 equals 0, which is the police. So in some cases, if it's not a medical incident but you still want to report something or need help, then you can call 110 as well. Now, what is the most important thing that the 112, the governmental emergency services, need to know from you? First of all, you need to know that this service is for life-threatening illnesses and injuries, things with head injuries, anything to do with heart or lungs, heavily bleeding wounds that are pulsating, or pain in the abdomen, for example, that reaches the level on a scale of 1 to 10, where 10 is the worst, from 7 and above. So they have life-supporting tools with them and medication, so that they can rescue life. Yeah. For the non-life-threatening injuries, there are some other options for you that we get to in a little while. Now, for this number, they need to know, first of all, where you are. So please, when you call this number, give them the location as specific as possible. If you don't know exactly where you are, you can give the name of the park that you're in and possibly the number on the trees around you. So every tree has a unique identification number. Also, the lampposts in Germany have unique identification numbers. So if you're on a broad road where you can't exactly tell the number of the entrance near the house that you're situated at, you can give the numbers of the 2 nearest lampposts that you can see, so that the emergency services can locate you. The next thing they want to know from you is what's happened. So here, when you tell them where you are, the control center, by putting in the address in the computer, it is flagged who is closest to you, so that they can tell you on the telephone, we're 2 minutes away, we're 4 minutes away, or we're 25 minutes away, depending on where you are. Here, when you're describing what happened, they will decide who needs to come to you. In some cases, the police will need to come automatically along. These are roadside accidents or criminal activity, but also sometimes domestic violence, for example, or psychological problems where somebody is at danger to harm themselves or harm others. The police will automatically be mobilized from the emergency services, so you don't need to call them in separately. We also have some medical emergency services. They are divided into RTW. It's called Rettungstransportwagen in Germany. Yeah, here you've got paramedics, but no doctor. If a doctor is needed, so say if the keywords are head injuries, heart, lung, pulsating and spraying wounds, heavy pain, that sort of thing, a doctor will come in the NEF, Notarzteinsatzfahrzeug, come separately along and hopefully stabilize the patient at the scene, and then they are transported in the RTW to hospital, and the NEF, the doctor on call, can go to another emergency. This is done in this way so that we can maximize our resources, because we have even fewer emergency doctors than paramedics. There's also the option of, what else do we have? We have the THW, Technisches Hilfswerk. They are big blue trucks, volunteers when there are emergencies with, for example, a big storm or a big accident with many cars, or a train wreck or something like that, or flood. The THW, Technische Hilfswerk, can come and help solve the situation. We have helicopters that serve as emergency helicopters if it needs to be intensive care transport, or it's difficult terrain to get to by car, that sort of thing, or it needs to be a very quick relocation of a patient from a different hospital to another hospital. with more specialized facilities, then we can use the helicopters. There's also the fire brigade. The fire brigade, they have obviously cars and material to fight fires, but they also have, for example, boats available to them when there's an incident on a lake or nearby a lake. They have suits that can, firefighters can walk under the ice and retrieve someone who's fallen through the ice in the winter. They also have cages, so if you as the first aider maybe see an incident where there is an animal involved, especially a car crash with a dog in the boot, for example, you need to tell the emergency services so that they can then bring a cage along to retrieve the animal as well. We also have the stroke unit in Berlin. Yeah, it's called the STEMO or stroke mobile for incidents with head injuries, or specifically a stroke. It's a blood clot on the brain. It needs to be treated very quickly. So we have 3 vehicles like this in Berlin, where there's a CT machine inside the emergency vehicle that can scan the head straight away for blood clots, and if there is a blood clot, we can then start treating it in the car. So therefore preventing the blood vessel from bursting. So therefore the person can have a speedy recovery the quicker it is treated. Now, first you have to explain where you are, then describe what happened. Depending on what happened, different emergency services are dispatched. Sometimes maybe even the army will be dispatched if it's a mass incident of casualties. The army will be deployed as well to help with that. The next thing they want to know from you is how many injured parties do you see? So how many is important because we don't have an unlimited amount of bed space in the hospitals, especially in Berlin, in big cities. We have limited resources again, and we need to know how many people are injured in which way, and how many of those need a hospital bed, so that we can already, before we start transporting them, decide where we're going to take these people. With this comes also the question of which injuries can you see on the patients. Yeah, so that means you have to examine the people, the injured parties, and find out which injuries are present or which organs of the body are affected. Yeah, so if you have head injuries or suspected stroke symptomatic, then we would have to take the patient to a hospital where strokes are treated, to a stroke unit or to a neurology department. Not all hospitals in Germany have all faculties represented. So for you in your personal, in your private life, it's also important to know which faculties are represented in the hospital near me. Maybe the emergency services are offline. It happens from time to time that no one is answering the telephone. Maybe they're overloaded, and you're in waiting line on the telephone to even speak to someone, but you have a relative in desperate need of medical attention. Then it's in your interest to be prepared and to know which faculties are represented by the hospitals in my area, so that when you have maybe a pregnant lady, a neighbor who is having problems with her pregnancy, you can take them to the correct hospital. If it's a child, you need to go to a hospital with a children's special unit. If you don't take them to the right faculty, then they will. The chances are that you could be possibly be sent away because they don't have the knowledge, they don't have the doctors with the specific knowledge, and they don't have the equipment for the diagnostic to help with this particular injury. So it helps for you to always just look at the situation. What do I have? Do I have a head injury? Do I have possible something wrong in the chest, the heart, the lungs? Or is it something with arms and legs where I need an accident, an emergency hospital? Do I have something wrong with the kidneys maybe? Not all hospitals have a nephrology. So if you are prepared and you prepare yourself in a calm environment on the weekend and on the sofa, have a look at what's available around you, and then you're most likely to address or drive to the correct place in times of distress. Now, we also have another request from you. Please wait in line. If you call these emergency services, they will ask you these questions automatically, so you don't need to remember them. I just want you to understand what's behind the number when you call this life support emergency number. So wait in line. They will guide you through the process of possibly a resuscitation if it ever comes to this, or give you different options what you can do with your patient according to the situation. Do you need to give your name? No, you don't. You can call even from the patient's phone, so you can remain anonymous. You don't have to give your name and number. It's nice for the emergency services on the telephone to be able to address someone, but it's not legally required. Do you have to stay at the scene? No, you don't. Yeah. If you have a responsibility to pick up your child from school and you come across a bicycle accident, your main priority is with the person in your care, and not with the third-party injury. Your absolute responsibility as a citizen or resident of this country is to register the incident with the authority, so that help is on its way. Yeah, so calling 112, 110, you can register the incident. Some cases, when unfortunately we have had fake incidents where people have faked an emergency for a criminal activity, to rob the car or mug the person, steal their money. For this reason, they've changed the law that you don't have to stay at the scene and you don't have to give evidence. You can just pass by, and when it's safe to do so, call the emergency services, register the incident, and then you'll be off on your way. Now, this is all when it's danger to life. But what can you do in terms of getting help when it's not so urgent? There are a few numbers that I like to introduce to you. We have, let's write them with yellow. Yeah, the red numbers are always very urgent care. If it's not so urgent, you can dial the 116, 117. Yeah. That is doctor on call. Doc on call. The doctor on call will come to your house. These are for things like if you're having food poisoning, vomiting, diarrhea, high fever, possibly an infection of some sort, moderate pain that you're not sure where it's going to go. And also muscle spasms, for example. Sometimes people have muscle spasms in their back, they can't move. They can get the doctor on call to come. They have medication. They cannot transport you, but they have medication against pain. They have muscle relaxants. They have the ability to write a prescription for antibiotics. And they also have the ability to write you a transport paper for a KTW, Krankentransportwagen, yeah, where you can call a commercial ambulance. They are the smaller vehicles. Sometimes you see them with a localized regional telephone number on the side. They also have blue lights. They also have a stretcher. They also have a wheelchair and staff that drive the car who have some medical training. You can call them and either pay them via the transport paper from the doctor on call, or you can pay them also by billing and then submit the invoice to your insurance company. Now, when we're talking about insurance companies, if this number is busy, you can also call your health insurance hotline. Health insurance hotline. It's 24/7. They have also medically trained staff to give you advice. So if you're facing a medical problem and you're not quite sure what to do with it, you can call your health insurance hotline, describe to them what you have as a problem, and then they will guide you through the process. The same here, medically trained staff will guide you through the process. They help you make the right decision. So if they think that doesn't sound good and that sounds like an emergency, they will mobilize an emergency vehicle for you, or they will suggest to you that doesn't sound good, please make your way to the nearest hospital. However, either they send a car to your house, or they can give you, at the health insurance hotline, they can give you the next available appointment, emergency appointments. All doctors in Berlin are obliged to keep a couple of appointments a day available for calls to this number, so that you can be seen as an emergency if you get there's a special code that they will give you, and then you can go to an emergency appointment at short notice. Another very important thing which I find very useful, and I've used this many times myself, is the landline number of the emergency room in my local hospital. Yeah, so I'm not meaning the 000, the reception, I mean the emergency room landline number. So I can only urge you to Google and save that in your telephone, the landline number of the emergency room in your local hospital. If all else fails and you can't reach anyone on the telephone, you can always call your local hospital emergency room. There is a doctor 24/7 available. So again, you can describe your incident, what you're faced with, and they will take some time. They are obliged to listen to you and to take some time to analyze the situation on the telephone, and then help you find the right decision. I give you an example. I called this once for my mom. She had symptomatic in her eye that she couldn't see in her eye. She had very high blood pressure, and she was very worried. She wanted me to take her to the emergency room straight away. I said, I'm gonna practice what I preach and call the emergency room number near the eye clinic where she's usually registered. And they said to me, we agreed together to give her some blood pressure medication that she has at home and takes regularly anyway, and to give her an anticoagulant, a blood thinning medication, which is available over the counter at the pharmacy, to avoid maybe a little blood clot that might be blocking her view. And the doctor on the telephone also said if the symptoms don't get better, subside over the course of 20 minutes, then I should bring her to her, I should take her to the hospital. So that did two things. First of all, we resolved the issue at home. Within 20 minutes, her blood pressure came down, and my mother could see again, and she calmed down, and we didn't have to spend the whole night in hospital. And the other thing was, if it wouldn't have gotten better, we would have already been registered on the telephone, and I would have recalled the hospital and said, right, it's not better, we're coming now, and they would have opened the doors for us without waiting time, because it's obviously then classified as a life-threatening emergency. So therefore, it works. That's all I'm trying to say to you. Yeah. So here are a few numbers available to you, a few options available to you in case the 112 is busy or it's not a life-threatening emergency. There are a number of other numbers that you can call. One of them is one for a suicide hotline. One is for domestic violence against women. There is a safe number for teenagers to call anonymously. If you are interested, then, or if you feel like you're facing with some of these problems, then please find out those numbers, or you can contact us and we advise about the emergency services available in those subjects. Also, one more I need to talk about is the 19240. This is the number that needs to be dialed with an area code, 030, or whichever city you're located at, and that's the poison hotline. The poison hotline can also help make the right decision in case of poisoning. There are many different poisons that are out there, so depending on how long ago it was, what has been consumed, have I seen it happen, have I seen somebody ingest something, depending on what the cause of the poison, the treatment can vary. So if a child has eaten a dishwasher tablet and you add liquid, it will foam up inside the body and it's counterproductive. However, alcohol poison needs lots of water to be diluted. If somebody has taken berries or plants that are poisonous, you can make the person vomit depending on how long ago the ingestion was. Same with prescription medication or drugs. Sometimes you can make the person vomit if it wasn't very long ago and if you've seen it happen. The poison hotline again has a number of questions for you, and depending on your answers, they can give you the course of action. And if they think it's too dangerous to deal with yourself at home, then I obviously would recommend a hospital near you that could help you treat that person or yourself if you are affected yourself. So I'm hoping that gave you a short, brief insight in some of the emergency services that we have available. And if you've got any questions, I'm Christina Maddox from the First Aid School Berlin, and you can contact us with your inquiries and we will help.